Hello, my name is Haley Rhodes, and today within my Biology 490 final assessment, I will be discussing the topic financial toxicity between cancer patients. So, a little bit about myself. I am a freshman biology student from Columbia, South Carolina, and after I finish undergrad, I have plans to pursue an MD to become a neurologist. I chose the topic financial toxicity because I think it's important to bring awareness to these type of health disparities that we face in America so that we can change things so people have the fair opportunity to receive the help needed. So I want to bring awareness to this quote that I found as I was doing my research for this overall project, and it says, "We don't travel, we don't do anything now because it's a $100,000 illness and it sucks." And this is from a patient named Janet who had breast cancer at the age of 67. And I feel like this quote is really important as it is emphasizing how people are affected by financial toxicity due to them not being able to afford the care needed for them to live. And I think it's really important as it shows how some people aren't given the choice on how to pay for their procedures and care. And I think this is the issue that we need to be talking about, because I think this issue needs to be fixed, because illnesses is something that can be controlled, but sometimes it is out of people's control. So I think it's important that we shed light on this because not everyone comes from the same financial backgrounds. So, what financial toxicity is it is when people face distress from high medical care and or can be when people have treatments that they have to pay for out of pocket, which can ultimately result in them being financially unstable. And this is so important, as stated before, because the study of this is something that a lot of people go through due to not having the money to pay for their needs. And if they do have a little something to afford it, it can cause them to be like financially distressed and cause them a heavy financial impact on their life and the people around them. And I feel like financial toxicity needs to be talked about more because it is important to shed light on things that people struggle with in terms of healthcare and financial issues. So it is important we find solutions to resolve these sorts of issues. So, in my introduction, my research question that I came up with was, how does financial toxicity ultimately impact cancer patients? And then my hypothesis was that financial toxicity will impact lower income areas more than higher income areas due to lower income areas not having the resources and money needed to help pay for affordable treatments and medical procedures. So the primary article that I used for this project was the article, The Financial Toxicity of Cancer Treatment, which is a pilot study assessing out-of-pocket expenses and the insured cancer patient's experience. So what this article touched on was how it ultimately took surveys of patients who pay out-of-pocket, and then patients who have co-payments, and then patients who are insured and have co-payments as well. So what this article touched on was a little bit of everything that I just listed. So my overall introduction was, the overall study is to solely focus on making sure cancer patients who need the assistance of a co-payment get the help needed to help break that health disparity of low-income patients not being able to afford treatments needed for them to survive. And in addition, the study focuses on making sure that people who are also getting insured get the help needed as well, because they can be financially impacted by low cost of treatments. Because even when people are insured, it can be hard for them to pay off the money that they have to put forward towards the treatments, because the copay doesn't cover everything, but it covers some of the procedure. And even though it doesn't cover everything, that cost that is still remaining can be a burden on somebody who doesn't make steady income or doesn't have the right means or is put in the same situation as somebody who has a higher income. So the hypothesis from this article was that copayment assistance will help people with low income and insured people afford medical treatment for their well-being. And this is to help people positively pay for cancer treatments they go through. So the methods they used within this article this overall study was surveys being distributed out to cancer patients who have co-payments, who are insured with co-payments, and people who don't have co-payments at all. So there was a survey distributed out to those people who had to fill out the information given. So within this article, the results that were shown, it's a table, as you can see, and within the table, it talks about how people had to alter their lifestyles to help pay for their prescribed meds needed for them to live in their cancer procedures as well. So as I did this, it stated that more than 50% of people reduced their expenses for leisure activities, 46% cut back on buying essentials such as clothes and food to help pay for their procedures, and 46% of people also used their savings to help afford expenses and medical medications and medical bills. It also stated how 17% sold their private items and possessions to pay out-of-pocket expenses. And I think this is really important to shed light on because everybody doesn't come from the same financial background, and it's important to show how people are put in some situations that they can't come out of when they accept treatments. So to help them pay for these things, they do things that they don't want to do but have to do to help afford their health care and to make sure they're healthy. And this figure also shows how the copayment assisted patients were the ones who reduced more spending than anyone on the everyday life of items, and because of those who used cost coping strategies to afford their care, it was positively correlated, causing people to have a financial burden. And after patients received medications, more data was collected, and it showed that 20% took less than what they were prescribed to due to the inability to pay for it all, and 19% only filled half of their prescriptions, 24% avoided filling their prescriptions, and there was a small percentage of people who didn't get the procedures they needed due to the cost. And lastly, there was 4% who skipped on their appointments to help them save money. The conclusions that I came up with for this was that people who have insurance that use copayments to help pay for their medications and treatments face financial burdens as well, and that was stated in the results from the figure that was shown, because people who essentially had copayments and that were insured ended up doing the most they needed to do to help pay for their procedures. And it also shows that they go through savings, take out loans, and make hard choices between themselves to help ultimately, in the end, help them afford what's needed for them. And my hypothesis was supported to a certain extent, because it is true that low-income people go through more financial hardships than higher income people due to them not having the same resources. But in the end, like, everybody goes through hardships in terms of financial instability when it comes to a procedure. And I feel like this issue is very important to address, as people who go through these things in these hard situations end up having to make ultimatums to figure out what will in the end help them will help them be better, because not all treatments are guaranteed to work. So some people feel as though it's a 50-50 chance depending on the type of treatment and the type of cancer. But in the end, I feel like this is something that we need to focus on more, so that everybody gets that fair opportunity needed to get well. And these are my citations that I used to help with this project. Thank you.